Hello, Dr. Kaiser and class. I am Janice Jewell, and I'll be starting this presentation about Cremona Hospital, and our topic is Logistic and Strategic Support and Governance. We are Group 3, and within our group, we have Alexa Canella, myself, Casey Gloria, and Andrea McCants. This is just an overview of the topics that we are going to touch on throughout our presentation, and who is going to discuss which topic in the presentation. I will begin with the synopsis. According to the Centers for Disease Control and Prevention, COVID-19 is a novel virus not seen in humans. Most people who have COVID-19 have mild symptoms, but can also cause severe illness and even death. Below is a diagram of the different symptoms that could affect people, like tiredness, high fever, difficulty breathing, and dry cough. COVID-19 mostly affects the older population and people with underlying diseases such as diabetes or hypertension. Coronavirus is a hybrid of droplet, contact, and airborne precautions. Represented in this slide is the world map and all the confirmed cases of COVID-19. In black and circled in red is the country of Italy. The CDC warns against non-essential travel here. So let's talk about Cremona Hospital and COVID-19. First of all, Cremona Hospital is located in northern Italy and was one of the first countries affected by the novel virus. Frontline's video inside Italy's COVID war shows Dr. Francesca Mangiatorti's, the main character's work, and personal experiences with COVID-19. All the while portraying the Italian healthcare worker and patient struggles in the hospital since the country's outbreak. So now that we know the background of COVID-19 and Cremona Hospital, let's go down into the nitty and gritty about the issues and the steps we can move forward to solve what we saw in the video and in the article. We'll begin with the diagnosis of issues from logistic and strategic support. Staffing and limited space allocation were the two most apparent issues when I first saw this video. As for staffing, there was a point in the video in which Dr. Mangiatori had mentioned that she originally had 11 providers and now she was down to 5 providers. Personnel were becoming ill themselves and thus were placed out of work in order to stop the spread to non-COVID patients and promote self-healing. Nonetheless, healthcare workers were dissatisfied and exhausted because of the continuous difficult ethical decisions to be made with the triage process and patient care, and also dealing with the limited staffing. As for limited space allocation, many patients were entering the ER for assistance. However, there was limited room for patients that needed to be admitted. Patients were left in the hallway or in a wheelchair until there was a bed available in the hospital. This can lead to patient dissatisfaction and endangerment to patient safety. Not to mention that patients in the hallway can lead to fire safety hazard. As for low resources, I refer to the article By a Hair, the Precarious Fight Against COVID-19 in Cremona Hospital, Italy. The author mentions that the spare oxygen tanks were about empty in the facility. Considering that COVID-19 causes difficulty in breathing, this places patients at a great risk for near death. Although not mentioned in the video, personal protective equipment was also in short supply. This places healthcare workers at risk for infection and possible spreading the infection to other patients in the hospital. The other two issues that I wanted to talk about was failed infection prevention policy and also failed emergency preparedness plan. And we'll start with the failed infection prevention policy. Although unknown at the time about the spread, how the virus was spread, all precautions were taken by the hospital, which they did do a great job on. The healthcare workers were wearing the hospital bunny suit, the scrub cap, gloves, mask, and eye gear. However, throughout the entire video, I observed healthcare workers touching their faces multiple times. Part of the campaign to stop the spread of infection was to wash your hands, wear a mask, and reduce the amount of times you touch your face. But what I saw in the video was that the main provider and the healthcare workers were performing the exact opposite of what was advised to the community, and thus it showed a bad representation for the function of branding for the hospital. They were touching their faces. As for the failed emergency preparedness plan, every hospital should have a disaster, emergency, or pandemic preparedness plan. In the plan, it should clarify and state what each department in the hospital would do if something were to happen, and then possibly improve if the original plan did not work. I am quite positive that there is no plan in place. Considering the circumstances, I am not sure whether any hospital in the world was ready for something like this. It is a rarity.
We will now move on to the steps utilized to address the issues from logistic and strategic support. Before we can focus on addressing the most apparent problem, which is staffing, we need to focus on keeping the population safe. This is why our group chose implementation and training of staff on infection control procedures as our step 1. As previously mentioned by Janice, even though the world knew little to nothing about the disease and which precautions to take, the hospital took all the necessary precautions. The healthcare workers were all in the proper PPE. However, our group noticed that throughout the video, a lot of the staff was touching their faces, sometimes even while wearing gloves. Hospital staff will need to attend a training and refamiliarize themselves on basic infection control practices. We know it's sometimes hard to remember to not touch your face, especially in emergency situations or when you're stressed out, but that is something that is a part of the campaign to stop the spread of the disease. Infection control is something that is extremely important for the safety of the staff and the patients. Step 2, addressing staffing, the most apparent problem. The Samaritan's Purse Emergency Field Hospital opened up in Cremona, Italy. With that came a disaster response team who is now caring for multiple coronavirus patients in intensive care. It's a nearly 70-member team comprised of doctors, nurses, biomedical and lab technicians, electricians, and water, sanitation, and hygiene specialists. This allowed for Cremona hospital staff to help Italians with other urgent medical needs. Step 3, implementation of a 68-bed unit. With the addition of the new hospital came more space for patients. The Samaritan's Purse Emergency Field Hospital is a unit that is comprised of a 68-bed unit, including 8 ventilator-equipped ICU beds, 20 general care beds, a lab, and a pharmacy. Patients were no longer having to be placed in hallways. We will now move on to the last 2 steps utilized to address the issues from logistic and strategic support. Step 4, hospital equipped with a respiratory care unit. To the addition of the airlifted hospital came equipped with a respiratory care unit and more than 20 tons of critical medical supplies. This helped Cremona Hospital with the low oxygen, low PPE issues they were dealing with. To continue to serve the community, Cremona Hospital will need help from a team like the Samaritan's Purse Emergency Field Hospital. Lastly, Step 5, addressing the failed emergency preparedness plan. They will need to create, edit, or revise an emergency preparedness plan. So this virus is something that the world was not prepared for, but now that we're a year into the pandemic, hospitals will need to create, edit, or adjust existing preparedness plans to address how to respond if a situation like this were to ever occur again. We can learn from what we did right and wrong and create strong plans for our hospitals.
Next, we will go over a diagnosis of issues from Cremona's governance. When reviewing Cremona's governance, we noticed 5 key issues within the hospital. 1. Compliance with laws and regulations. 2. Healthcare procedures. 3. Quality and safety of patient care. 4. Community awareness. And 5. Healthcare procedures. Compliance with laws and regulation issues were: stakeholders were not provided with enough information from the public officials to discuss health issues and threats related to the coronavirus. Several times in the beginning of the video, Dr. Mangiatorti mentions how no one knows how to fight the coronavirus. They are trying every method they know, but the virus is taking over people's bodies. This is a brand new virus no one knows about. When the virus initially broke out, no one knew how to treat it or prevent it. They were having to choose between people's lives based on who had a better chance of survival. Issues with healthcare procedures were Cremona Hospital did not have a proper plan for emergency and disaster management. The volume of patients the hospital was seeing was something they were never prepared for or even dealt with in the past. Cremona didn't have a proper disaster plan for an event like the coronavirus. Doctors and nurses were being put at risk, patients were all over the place, there was not enough room or order on how to handle something as catastrophic as this. 3. Quality and safety of patient care. The safety of patients was at risk. Patients who needed emergency services that were not COVID related were put at risk because of previous protocols. Before the pandemic, any patient brought in by an ambulance was taken into the emergency room. Since it was not addressed properly with COVID concerns, patients who needed treatment unrelated to COVID were being exposed to an emergency room filled with infected patients. In the video, they show a patient who is in critical condition unrelated to the coronavirus being transferred from another hospital. Usual protocol is for an ambulance to bring patients directly into the emergency room. The protocol was never revised, so the lady was brought into an emergency room filled with coronavirus patients, putting her at risk. Dr. Mangiatorti mentions how they need to get her out of the room as quick as possible because she's at risk by being around the infected patients. Community awareness was a huge problem for Cremona Hospital. Preventative measures were still in question since transmission was unknown at the beginning of the outbreak. Information regarding the coronavirus was very limited. The hospital wasn't able to help their community because they were focused on protecting their doctors first. There was a shortage of masks, sanitizers, and there was not a vaccination in sight. It was hard for the Cremona Hospital to reach out to their community to explain preventative measures. As previously mentioned, they knew little about the virus and couldn't explain how or why this was being transmitted so quickly. Healthcare procedures was also another problem. The number of COVID cases was constantly fluctuating, and it was difficult for the board or stakeholders to create a long-term plan on how they wanted to deal with the virus. Dr. Mangiatorti explains her frustrations about the long-term plan for the Prime Minister to reopen their city. She says they did not realize the severity of the virus and the risk it poses to the public. She mentioned how dangerous it is for stores and cafes to open again since they don't know if someone's infected or not. Long-term plans placed in the hospital were also affected. Dr. Mangiatorti begins to feel good about containing the virus until she sees numbers rising again. One day they have tons of beds available, and the next day they're overflooded with patients. The numbers are constantly fluctuating, and because of this, long-term plans are hard to follow since the end of the virus isn't in sight yet.
Andrea will now move on to the steps utilized to address the issues from Cremona's governance.
Steps utilized to address the issues from logistic and strategic support. Step 1. Addressing the virus can be challenging because of the rapid interpretations of what is happening in real time. To overcome this, it is essential to take action early on when the threat appears to be small or even before there are any cases. Step 2. Proper information and communication to the public while in the early stages helps reduce the spread of the virus, along with following the guidelines from public health authorities. Step 3. Addressing quality and safety patient care. There are difficulties of making decisions in real time when a crisis is unfolding because of the shortage of medical supplies. An example would be the lack of beds for the COVID-19 patients. Step 4. Collecting and distributing accurate data along with expert analysis assists the stakeholders and healthcare providers to figure out the most appropriate plan of action. Step 5. An effective approach towards COVID-19 requires coordination among the healthcare system, which includes testing facilities, hospitals, primary care physicians, and as well as resources from the public and private sector.
And just like that, everything must come to an end. Considering the information briefed throughout this presentation, Cremona Hospital will adapt as necessary moving forward, ensuring that both hospital staff and patients are protected in every aspect of healthcare. It seems like there is no end in sight for the virus. However, as new research emerges with each passing day, we will warrant that the hospital will closely be following. I would really like to emphasize that we are not alone in this fight against the virus. It is only conscionable to reach out to nearby hospitals for assistance if there is another spike in cases. While doing so, we must keep infection control and community outreach into consideration. Continuously providing the community with information about the virus and showing preventative measures will help contain numbers within the hospital. The more the community is aware of the severity of the virus, the more seriously they will take it and help fight against it. And I end this presentation with Marie Curie, who is a female physicist and chemist who conducted research on radioactivity in the 1900s. She quotes, "Nothing in life is to be feared. It is only to be understood. Now is the time to understand more so that we may fear less."